Once again, doctors and nurses are facing burnout as hospitals fill up with yet another wave of COVID-19 patients driven by the Delta variant. Mississippi is experiencing one of the worst outbreaks in the country. Just 34% of people there are fully vaccinated, and this month, hospitalizations are up more than 450%. Omar Villafranca visited St. Dominic Memorial Hospital in Jackson, Mississippi, where healthcare workers say they are worn out and frustrated, but still powering ahead for their patients.
The worry really never goes away.
Wendy Gwines leads the nurses in the ICU at St. Dominic's in Jackson. She's been through COVID surges before, but this one, with the Delta variant, is leaving everyone exhausted.
What do you worry about with your crew?
This go round, I'm very concerned about PTSD. I'm worried about burnout. I'm worried about them questioning their choices of going into healthcare.
The worry is mixed with grief. Earlier in the pandemic, her team lost a colleague in the same COVID unit where they all worked.
What was the emotion in the room when that was happening?
There was anger. There were tears. There were, there was frustration.
Frustration at what?
That we're here, that we're actually having to work on one of our healthcare, team members.
Dr. Reginald Martin is a surgeon here, but last year he was a patient fighting for his life.
2 weeks before my hospitalization, I rode a bike 75 miles. 2 weeks after my infection, I couldn't walk to the bathroom without getting short of breath.
How do you tell people out there you don't want this? What do you tell them?
I just blatantly remember is being in that hospital room with my O2 saturations in the 80s, being unable to breathe or take a deep breath. I'll relay that story to every patient that comes in and tell them, that you got to get this vaccine.
But like so many, he feels frustrated that not everyone is using the tools available to them.
It's incredibly frustrating to know that you could have done something different, that you are potentially a threat to my health. That's frightening.
Despite the frustration, the care continues. Dr. Bharat Malhotra admits, so does the heartache.
What would happen to you if you were actually to stop and slow down and hear each individual patient's story? Do you think you could handle it?
No, I don't think so, because then there will be so much helplessness I will be seeing in them, and there will be nothing I can do for it.
But one memory haunts him. A woman dying in his COVID ward, writing down 4 pages of her final wishes for her son.
Did you have to give those last wishes to her child, or did she?
I did.
Did she make it?
No.
For CBS This Morning, Omar Villafranca, Jackson, Mississippi.
Imagine how frustrating it is for the medical community to see people dying when all the experts say this could be prevented.
Yes.
Nobody has to die anymore. If you get the vaccine, nobody has to go this way.
We have the weapon to stop this.
Yeah.
And people are choosing not to use it.
So much focus, too, on those who've died, but also you think of the after effects, the effects, rather. Thousands of people who are still struggling with breathing and, as he talked about, not being able to ride his bike.
Yeah.
What's got me freaked out again, even though we're all vaccinated, I now start smelling the Vicks Vapor Rub again every morning. I'm like, oh, good, I can still smell it good.
Exactly.
Taking my temperature now all the time, because now I'm just nervous all of the time.
Yeah.
Doesn't have to be this way, America.
Yep.